Dr. Tani Ping, consultant obstetrician and gynecologist, and the topic for today is fibroid, polyp, and adenomyosis. Why I choose these three is because they have so much similarities and there is also so much differences. And many people are very confused. So today we're going to talk about fibroids, polyps, and adenomyosis. But all three are not the same. They are totally different and they have different risks, different symptoms, and they are basically different things. But it's very often confused, especially when patients come to see us. They always come and tell me that doctor told me got this thing, doctor told me got this thing, but then they are very confused whether it's fibroid or it's adenomyosis or it's polyp. It's totally three different things, three different diseases, three different problems, but it looks and sounds like the same because it's all the so-called 肉瘤or 肉瘤 in Chinese. So now, that's why today I decided to talk on all three things. And we want to differentiate these three things from each other, okay? So now you know the first similarity we know is a form of a mass that is made of flesh or muscle. To be more exact, it's something like muscle, but it's not necessarily muscle either. But the Chinese term, they always like to put it as 肉瘤, and then they don't know which one, whether it's fibroid or adenomyosis or polyp, which all three things are totally different. And if you actually go into the exact medical term of fibroid, polyp, and adenomyosis, none of it is called 肉瘤. So 肉瘤 is like our basa like that, you know. So I always say Chinese people in Malaysia all talk basa. When I speak to patients that come from China, I cannot say 肉瘤. I say 肉瘤, they're like, huh? Okay, that's true Chinese. Okay, so yeah. So we want to know the difference. What is the difference? Let's go one by one. The first thing I'm going to talk about is fibroid. Everybody know what is fibroid. A lot of people hear about fibroid. Fibroid is very common. Okay, so fibroid is actually a tumor which is a growth originate from the muscle of the uterus. So it originates from the muscle of the uterus. So any growth that originates from the muscle of the uterus, we call fibroid. Okay, so first thing, fibroid is growth originate from the muscle of the uterus. Then we have what do you call that, polyp. What is polyp? Polyp is a growth from the inner lining of the uterus. So it grows from the inner lining of the uterus. So when you have a uterus, you have inner lining and you have muscle. Later I will show you some pictures. So it is a growth from the inner lining of the uterus. So when you have growth from the inner lining of the uterus, then you will have the growth that comes up from it. So I have explained about fibroids, which is growth from the muscle of the fibroid, muscle of the uterus, and then endometrial polyp. Polyp is the growth from the inner lining of the uterus. And last of all, I'm talking about is adenomyosis. Adenomyosis is the growth which is endometriosis in the muscle of the uterus. So it's endometriosis in the muscle of the uterus. And we know endometriosis is the inner lining of the uterus, but now the inner lining is not in the inner, but the inner lining is not in the muscle. Oh, I know now some of you are confused. So we have a growth from the muscle of the uterus, and we have a growth from the inner lining of the uterus, and now we have adenomyosis is the presence of the inner lining of the uterus in the muscle of the uterus. Oh, I hope you get it right. I hope you all are clear. Let me show some pictures. Okay, this is a picture of fibroids that you can find from any Google. So they are So they are growths that grow in the muscle of the uterus. So you can see there are many types of fibroids at different locations of the uterus, but it is a growth from the muscle. Then, if you want to talk about polyp, this is what we will call polyp. Now this growth is from the inner lining of the uterus. Because now you can see the uterus, you got the muscle which is here, and this is the inner lining, and this growth is growing from the inner lining of the uterus, and this we call as polyp. Okay, polyp. And next I want to talk about adenomyosis. This is adenomyosis. Adenomyosis is supposed to be the inner lining of the uterus, which is usually we call period blood. Inner lining is period blood. But now it grows inside the muscle. Inner lining is supposed to be only on the inner surface of the uterus. But now it's grown on the muscle. In the muscle, sorry. So this is adenomyosis. So why is there a lot of confusion and a lot of difference? First, I would want to tell you what's the difference between fibroid and adenomyosis. Why so much confusion? Okay, fibroid is the growth of the muscle of the uterus. Adenomyosis is the inner lining of uterus growing inside the muscle. So, in other words, everything is growing in the muscle. It's either the growth originate from the muscle of the uterus or the growth originate from the inner lining of the uterus, but it's now all growing in the muscle of the uterus. So as a result, it is always a growth at the same location. The location that it can grow is the same location, which is the muscle of the uterus. So when we do ultrasound scan, sometimes can be very confusing because when we do ultrasound scan, we will see the growth in the muscle. So any growth in the muscle, it can be fibroid, it can be adenomyosis. And trust me, I don't blame confusions from any of you because doctors also can be very confused because very often we see things like that. You get somebody who do an ultrasound, somebody tells you it's a fibroid. And then this patient can go to another doctor and then the other doctor will say, oh, I scanned this, it's not fibroid, it's adenomyosis. Then this patient is confused. One doctor say fibroid, one doctor say adenomyosis. So I go to third doctor and third doctor scan may say it's fibroid. Then you try fourth doctor, say adenomyosis. Aiyo, how? Why? Because fibroid and adenomyosis is not so easy to differentiate on ultrasound scan. Because what we are doing is ultrasound scan. So we can't really tell the difference. It's not too clear. It can tell, theoretically can, but sometimes may be difficult. In most cases, it's quite clear cut. It's quite clear cut. We can see this is fibroid, this is adeno. But sometimes we can still fall into a trap. We thought it's fibroid, but it's adeno. Or we thought it's adeno and it's fibroid. So when will we actually know? Very often, we only know when we are operating on the patient. Okay, so what happened? This is very common, very common. A doctor just scan, sees fibroid. It tells you, come, there's a fibroid, you need to operate on it. So you go in and do the surgery. And then doctor cannot find the fibroid. Why? Why cannot find the fibroid? Because fibroid and adenomyosis, there's one difference. Fibroid, we always say, is nice and round. It's nice and round in the sense that it has a capsule. So I can nicely differentiate or spread the fibroid from the uterus. So I always like to describe like you eat a rambutan. All of us eat rambutan, right? When we peel off the skin of the rambutan, nice. The skin of the rambutan is outside and the rambutan flesh is inside. So let's say the rambutan flesh is your fibroid and the skin is the uterus. So fibroid, very nice one. We can actually peel the whole uterus away from the fibroid and I get a nice fibroid. Okay? I get a nice fibroid. Very nice. This is a fibroid. But adenomyosis is not. Adenomyosis, you can't peel away from the uterus one because it is not growth within the uterus, it's the inner lining inside the uterus. So there is no actual growth. So you can't peel anything off. So it's a bit like, you know, when you operate on adeno, it's a bit like peeling an orange now. Okay, we don't talk about mandarin orange, we talk about the normal oranges that you buy, the sun-kissed orange. When you peel the skin of the sun-kissed orange, you can see there's still skin on the flesh, right? Sometimes you can be so good, you try to peel better and hopefully you can get a real separation between the skin and the flesh. But we know it's not so simple. A lot of times still partly here, partly there one. If you try to be very careful so you can still get it partly here, partly there. You have some amount of the skin on the flesh. If you go a bit deeper, some of the flesh comes out to the skin. So it's not easy to peel. Adeno is something like that. There's no way we can nicely peel the adenomyosis from the flesh, from the skin of the uterus muscle. So when you do a surgery, you will know. Because we go in, we thought it's fibroid, then we think that it can peel nicely. And then suddenly, ayo, cannot peel. Aiya, this is not fibroid, this is adeno. Or you'll be thinking, oh my God, if I let my doctor like that. But that is the reality. That is the reality. It happens every day. We see it so often everywhere. Be it me or any other gynae will tell you the same thing. So that's why there's a lot of confusion. But we can roughly tell sometimes. We can roughly tell. Why? Number one, fibroid, no pain. Fibroid has no pain. Whenever a patient come and see me, say, doctor, I know I got fibroid. Now my fibroid, every month menses very painful. If you tell me your menses is painful and you got fibroid, ding, my brain will be thinking, fibroid pain? Maybe this is adenomyosis. So this is what happened. Sometimes when you tell us when you're in pain, the first thing we think about in our mind is maybe this is not fibroid, this is adeno. But you can still have fibroid plus endometriosis. That means I have fibroid, it's truly fibroid. But I got endometriosis, but my endometriosis is not adeno, it's not in the uterus muscle. My endometriosis is outside the uterus. So if you have endometriosis, also you have period pain. So if you have fibroid plus endometriosis, you can still have period pain with fibroid. But you see the tricky situation here? Because I scan fibroid, endometriosis, I cannot see on ultrasound. As in many of my live video I've mentioned, endometriosis cannot see on ultrasound. So I don't see endometriosis, I see fibroid, and then you have pain. So if you have pain with fibroid, two possibilities. Number one, it's either your fibroid is not fibroid, it's adenomyosis. Or number two, you have fibroid plus endometriosis, that's why you have pain. So that is the two possible situations that we have to think about if you tell me you have fibroid and you have menstrual pain. Because fibroid has no pain. Fibroid is never painful every month. No such thing. Okay? So, but trust me lah, most of the time we can see the difference on ultrasound. We more or less can tell the difference. But only sometimes we get conned. We get conned by the fibroid or the adeno. It looks so much like adeno. Because I have also seen cases that have seen so many doctors say it's adeno, and then my sonographer also says it's adeno. I scan also I say it's adeno, but I went and do surgery, it's fibroid plus endometriosis. Let's say I scan, I see adeno, but you are so sure you have no menstrual pain, then also I will think most likely it's fibroid. But I will still see what I see on the ultrasound. Most of the time we can see the difference because in most time, fibroid, because there is a clear difference between muscle and the fibroid, we should nicely see a line on the fibroid usually. We say the capsule of the fibroid. But sometimes if adeno, we are not supposed to see that because it's part and parcel of the muscle, so we cannot see that. So you see, when you have fibroid and adeno, first thing you differentiate is like that by looking at the pain that you have, got pain, no pain. Because other than that, bleeding, they all bleed. They all can bleed. They also can don't bleed. Some fibroids bleed a lot, some fibroids don't. Some adeno bleed a lot, some adenos don't. So that one cannot see. The only thing you can see is from ultrasound, as well as whether there is any pain. So confusion will only come if we already know you have endometriosis, like you already have endometriosis operated before, or you have endometriosis that we can see on ultrasound. And then so definitely you have pain, right? Then you also can have fibroids. So then you don't know whether you have endometriosis with adenomyosis, which is supposed to be the same disease, or you have endometriosis with fibroid, which is also can. Two different diseases on the same person. Very possible, because these two, I always like to say they are good friends. Fibroid and endometriosis are good friends. They like to stay together. So these are one of the situations that we can get. Treatment-wise, big difference. Okay, of course surgery will be the same. You want to do surgery, you can do surgery for fibroid, you can do surgery for endometriosis. No adenomyosis, no problem. Both also can do surgery. But what's the difference when we do surgery? Number one, fibroid, I told you, you can nicely separate away from the uterus. But adenomyosis, you cannot separate away. And adenomyosis is actually endometrial lining, the lining of the uterus growing inside the muscle. So in order to remove adenomyosis, you actually remove muscle of the uterus. When I remove fibroid, I never remove the muscle of the uterus. The whole uterus is intact. If I remove adenomyosis, I actually remove part of the uterus muscle. Then your uterus muscle has a gap. Of course, we will stitch it back, but it has its own issues when it comes to childbirth. You can still get pregnant and give birth, no issues. But when you go and give birth, we will consider a high-risk birth. So that is the only difference, okay? So that's why most of the time, adeno, we usually try not to operate unless we have no choice. So we try not to operate unless you have no choice. So let's say if I do not want to go for surgery, is there other option? Yes, we can try and get pregnant. If you can get pregnant, it's good news for both. Fibroids can die in pregnancy. Adenomyosis shrink. They shrink in pregnancy. Adeno shrink in pregnancy. Fibroid die in pregnancy. So getting pregnant seems to solve the problem. Okay? Or else, the third form of treatment is medication. Medication is where the trick is. It's very tricky because the medication that will usually we use medication for adeno. But let's say we use this medication for adeno, if our ultrasound is wrong, that means let's say it's a fibroid, it's not adeno. Then if you give the medication for adeno, you actually make the fibroid grow bigger. Because these two are opposite. Anything that stimulates the adenomyosis, any medicine that work on adenomyosis, fibroid grow bigger. Any medicine that work on fibroid, adenomyosis grow bigger. Why? Because they all talk about progesterone. One is a progesterone, one is an anti-progesterone. Progesterone is good for adenomyosis, but fibroid, you need anti-progesterone. So if you give progesterone to the adenomyosis, if it happen to be a fibroid, then your fibroid grow bigger. So medicine is a bit tricky. So you need to watch. Whenever we give medicine, we need to scan closely. Okay, so this is fibroid and adenomyosis. Then I want to talk about what's the difference between fibroid and polyp. Okay, there is also a difference. I will bring back my picture again. If you remember the fibroid I showed you earlier on, yeah, these are fibroids, so many fibroids. Just take note of this small little fibroid inside. You see this fibroid is inside and it seems to be growing from the inner lining of the uterus. So let's show you a polyp. Woo, this is a polyp. It looks the same. Yes, it looks the same. Because it looks the same. In fact, it will look the same. Ultrasound, more or less you can tell because the color, one is whiter and one is not so white. But as I say, most of the time we are correct. But sometimes we can still be wrong. So what happens is, again, when we go surgery, we will know the difference. What's the difference? Both look the same. But one is soft, one is hard. Okay? Fibroid is very hard. Polyp is very soft. So that is the difference. So when we go and do surgery, of course we can tell the difference because when we take it out, we know what is soft, what is hard. But ultrasound also by right should be able to see because hard, the fibroid tend to be harder, so the intensity is very much coarser. Polyps usually looks much nicer and smoother. But of course, once in a while we can get caught, especially with very, very big polyps. We thought it's a fibroid, it can be a polyp. And it can be the other way around as well. We have seen polyps, small ones, very small polyp. We thought, yeah, so small must be polyp, then go in is a fibroid. Okay, so whether polyp or fibroid is the same in the first thing that is the same within these two. Their symptom is the same, depending on the size. Small fibroid and small polyp, same size, if both of them same size, they have the same symptom. They either give us heavy menses, especially with big fibroid or big polyp, also heavy menses, or they can also cause those little bleeding that happens when it's not supposed to be menses. Example, you have your menses supposed to finish at 5 days, but a bit of bleeding, bleed, little bit until maybe 10 days, 14 days. That one also can be due to these two conditions. Or you have your menses finish already, stop 1 week, and then suddenly bleed a little bit for 3-4 days, and then stop again. Then don't know when you want to bleed again, another 1 day, 2 days, and then stop again. This can be either polyp or fibroid. Same one. Both of them behave the same. So their symptom is the same. When we scan, we see more or less the same thing. Most of the time we should be able to tell the difference. But that is why there's a lot of confusion. Okay? So these three things actually a lot of confusion. But actually they're all three different diseases. Because when it comes to fibroids, they're inside the uterine lining as well as polyps, usually we need to remove if it causes you bleeding problem lah. There's no medicine for these two conditions, so we usually have to remove, but you don't need any big surgery one. Why? I'll show you a picture. This is what we do with polyps and also fibroid. We put something in from below, from your vagina all the way in. I put something in, and then we call it a shaver. So you can shave the whole thing out. So it's like a suction, something suck the whole thing into the thing, and then it's shave. So like a blender machine we put inside like that lah. Okay, I always say blender, sounds scary, but it's not blender, it's a shaver. So we can put that little thing from below, take it all out, and then you can go home. And then tomorrow you can work. Because what? No pain ma. No pain. It's a very minor surgery. It doesn't involve any pain. In Malaysia, we still usually will put you under anesthesia. Very fast one, this surgery. 5 minutes, 10 minutes, settle. Put you under anesthesia for 5-10 minutes. Take the whole thing out. Then after that, wake up, you go home. And then tomorrow you work. So it is a very simple surgery. So this is the situation where we can remove even fibroids for this thing. That's why if you have fibroid and you have bleeding, because this is a type of fibroid that always bleed. So if you have fibroid and you're bleeding, then you may consider doing this type of surgery. Then you don't need to do any other surgery, but please bear in mind, we can only do this in small fibroids. We cannot do it when you're 10 centimeter, it's not possible. 5 centimeter is my cutoff for fibroids that are bleeding. Bleeding fibroid, less than 5 centimeter, no need any major surgery. Just put that little tube in and just suck everything out. Simple. Simple as that, okay? So, if you have this type of fibroid, you do not need any major surgery. You don't need open surgery, you don't need laparoscopy, you don't need robotic, you what also don't need. Okay? You just need something to go in, shave, come out, tomorrow go back and work. Okay, so that's so simple for those fibroids that are inside the uterine lining, that grows from the uterine lining. So I hope all of you are clear now. We have these three conditions, three different conditions with three different diseases. So what about risk? Polyps are a bit riskier because all uterine cancer start from polyp. So you know, bowel, colon cancer also start from polyp. Uterus cancer also start from polyp. They usually start from polyp, not from fibroids, not from adenomyosis, it's from polyp. Adenomyosis usually will be linked with endometriosis. If they ever call cancer, it's ovarian cancer, so it's not uterus. My Sarah asked, what is medication for adenomyosis other than Visane? So adenomyosis, there's a lot of medication. It's more or less the same as endometriosis, but we like to use Visane is because Visane is less side effect, can take long term. That's why we try to take Visane. But there are other medications, but they normally will have either more side effects or more complications. So that is why we usually try to use Visane. Okay. So there are others. You can always use Mirena, you can use Danazol, you can use Supreme, you can use just simple oral contraceptive pill, but some of it is not so effective. So you also must see how effective it is. So even for all the medication that we use for an adenomyosis, as I say, it has to be progesterone. There's too many progesterone out there. Every progesterone has a different profile of side effects. So you have to look at what side effects is better for a woman. And also, every progesterone has different strength. Some are stronger, some more potent, not so potent. So you also must depend on your adenomyosis, what level, what stage, how severe. So very severe one, normally we want to try something stronger. Not so severe one, then we don't try something stronger lor. So there are actually many options of medication other than what do you call that? Visane. Is it genetic related? Adeno? No lor, it's not genetic related lah. But you see it a lot, right? You see a lot of people getting endometriosis, adenomyosis. Why? But it's only people today. If you actually go and ask your mother, your grandmother, where got so many people get adenomyosis and endometriosis? Those days, it's rarer. It's a disease of modern women. Okay, I always like to say it's a disease of modern women because if you look at the endometriosis talks that I give, one of the factors is delay in childbirth, number one. We don't give birth to so many children now. We get married older, we give birth older, and our life is also more stressful. If you stay in kampung and you tanam sayur and then turn up all your your ayam ite is enough already, then actually your chances of adenomyosis and endometriosis also less, okay? Rachel asks, what is the recurrence rate of adenomyosis and endometriosis for women who have Mirena after laparoscopy? I told you, I think if you look through at my endometriosis video, where we talk about how to prevent endometriosis, I already mentioned that it's multifactorial. Okay, so because the causes of endometriosis, number one, I want to know whether your surgery did do a complete removal. Complete removal, number one, will keep you safer already. If you do a surgery, like majority of people actually don't get a complete surgery, then of course the recurrence rate is higher. Then to put Mirena, of course we control. It's supposed to control because number one, it has progesterone, and then number two, it reduces the amount of your menses. Number three is what about your stress level? So what is your stress level? So are you still very stressful in life? Then of course endometriosis will still come back. No matter what a doctor can do in your laparoscopic, no matter how good Mirena is, but if you're still stressful, then you come back. Okay, it's multifactorial, so it's a lot of factors. Xiaowei asks, I have adeno, able to deliver first kid 5 years ago, second kid miscarriage, until now not able to conceive. May I know, is the adeno really hard to conceive? Half lor. Xiaowei, the reason is the possibility half lor. The reason why you're not conceiving may be due to adenomyosis. Now it's worse than before, or your adeno actually is the same, but maybe now you got more stress. You're more stressed. Why you're more stressed? Because you got a miscarriage. Adding one more that after a miscarriage will be more stressful. I have so many women that I see after one miscarriage cannot get pregnant. The first pregnancy very easy, but because miscarriage then they cannot get pregnant. But they got no adeno one. So that is why it can be due to adeno. It can be also due to the miscarriage that you had. It can also be some other stresses that happen to you after your miscarriage. Okay? Amy asks, is period pain normal? No, women are not supposed to have period pain. Okay? Anyone with period pain, please go and see a gynae. Okay, the only people who are supposed to have period pain are teenagers. Teenagers, period pain, fine. But that also should not affect them to miss school, to take painkillers, and to stay at home and cry. No, that is not normal. Period pain for teenagers are supposed to be tolerable. They're supposed to still be able to go to school. If they have so much pain that they cannot go to school, need to take painkiller, need to go for injection, need to vomit after the pain, after the period pain, even for teenagers, I would think about endometriosis. There are many studies shown that pick all the teenagers with period pain. Actually, you'll be shocking when you see the result. Actually, 90% of the patients with teenagers with period pain also have endometriosis. But the thing is, we can still accept period pain in teenagers is because as long as once they go into their 20s, the period pain go away, means the endometriosis is gone, then it's fine. But if the period pain still persists in your 20s, 30s, 40s, no such thing. Okay, women in a mature age group should not have period pain. When you have period pain, please think of endometriosis. Most likely you have. It's a matter of how bad. Okay. Chi-Ling asks, Doctor, you mentioned getting pregnant will help improve fibroid and adeno, but will having any of these increase the risk of miscarriage during pregnancy? Number one, yes, it increases the risk, but the risk is not very high. Okay, it's not like more than 50% you're going to miscarriage. No, most likely again you won't miscarriage. You must understand general population already will miscarriage, which is around 20 to 30%. So 20 to 30% of our pregnancies will miscarry. So if you have a miscarriage and you have fibroid or adeno, it's very nice to actually blame the adeno and blame the fibroid because people will just accept it, but not necessary, because we know it only increases maybe by 5 to 10%. It doesn't actually increase double or triple. Okay, so yes, it does, but it usually doesn't. Okay, but sometimes a lot of women, once they have a miscarriage with their fibroid adeno, they rather they rather have it taken away. Then I feel that when they request for me to remove their fibroid adeno because of their miscarriage, I sometimes will do it. Why? Because if I don't do it, they will always think that they're going to have another miscarriage because their fibroid and the adeno is still there. And if they're so stressed up, they either don't get pregnant or they will definitely get another miscarriage because they're so stressed out. Please refer to my video on miscarriages. Stress also causes miscarriage. So sometimes get rid of the problem that will stress them. In a way, we get rid of their stress. So we get rid of the stress, then they will get pregnant easier, and they also will most likely have a smoother pregnancy the next time. Okay. Okay, Ben Chin asked, she said last December she scanned and saw a couple of 2 centimeter fibroid, not painful. So not painful, then I'm very sure it's fibroid lah, it's not adeno. But just that it's slightly heavier menses than in the past. Should I get it removed or leave it? So at the end, I will also look at the fibroid where it is. If it's really at the location where I showed earlier, like what a polyp would look like, then 2 centimeter I will remove it now. Because removing it 2 centimeter, I can just put a simple tube in and just suck it out. But if I'm going to wait until it's 5-6 cm, and then that time I'll be pouring out blood like, you know, tap water, that time I don't know whether I can still do a simple surgery for you. So for cases that we call submucosal fibroid, that is the term for the fibroid. Submucosal fibroid are the type of fibroids that usually cause bleeding. And submucosal fibroid, as long as it's going to grow bigger, it will definitely bleed more. It bleeds more as the fibroid grows bigger. So eventually, if it grows like 4 to 5 cm, trust me, submucosal fibroid, 4 to 5 cm, you will be bleeding like a pipe already, pipe water flowing out. That one nobody can tahan. That time you sure want to operate. You don't want, people don't operate for you, so you want to be operated. But with such a big fibroid, then you will need a bigger surgery. You may need a laparoscopic or a robotic surgery for your case. So if you do not want big surgery, if you want a simple surgery that you can go back on the day itself and work the next day and no pain, no suffering at all, please do it when it's small. 2-3 cm is the best. More than 3 cm, sometimes I have to do it twice. Although a lot of patients rather do it twice because it's anyway not painful, but it's still twice. 5 cm and above, I cannot do it anymore with a simple surgery. So please get it done. Please check, double check and see whether it's a submucosal fibroid. If it is a submucosal fibroid, then please get it done early. Okay, just with a simple procedure from below. Go in and suck out the fibroid, okay? Xue Wei asked, she has a 1.6 centimeter polyp and suspected endometriosis based on the symptoms and the ultrasound scan. As mentioned by doctor just now, uterus cancer starts from polyp. How should I monitor my polyp? Okay, simple. Because endometrial polyp, if it doesn't cause you any form of abnormal bleeding, it won't turn cancer one. So once you have abnormal bleeding, then you need to remove. After all, the procedure is only 5 minutes and no pain, no suffering, and can go back to work the next day and no side effect. What's stopping you from doing the surgery, right? So most importantly, we just look at whether the polyp affect you. Only 3 situations. One is it's giving you the abnormal bleeding. That means either the little bleeding that drag after your period, or comes before your period, the little bleeding, or the little bleeding that comes any time they want, not period also it comes. That is abnormal bleeding, or bleeding that comes after you menopause. That one you definitely have to remove. Okay, so polyps that also have heavy menses also need to remove. Okay, so polyps that bleed have to remove. That's the first reason. Second reason for removing polyp is people cannot get pregnant. Polyps that don't let you get pregnant must remove. Okay, but actually, if you cannot get pregnant, whether it bleed or not, you have to remove. Especially you see, if you go for IVF, the moment the IVF doctor see the polyp, they say must remove. Because the polyp in IVF will not succeed, so simple logic, right? If got IVF, your polyp IVF will not succeed. Obviously, even you want to try to get pregnant on your own with polyp, it's going to be difficult. So if you cannot get pregnant, then polyp have to remove. The third situation where you need to remove polyp is you already menopause. You already menopause, 1 year, 2 years, 5 years, 10 years, the polyp still there, you better take it out because we know there is a potential to be cancer. What if you get the cancer when you're 70, 80? Big, you're old, you are not so healthy and you have to do big surgery, not so good, right? So better remove the polyp before you grow too old, okay? So Sherry also said that she's now taking Bisane for endometriosis. Well and fine, you can take Bisane. So the only thing about the polyp is as long as you have abnormal bleeding, then you need to watch out. But when you're on Bisane, you will have abnormal bleeding, so you wouldn't know. But at the same time, Bisane also suppresses polyps. So in a way, your Bisane works for both endometriosis and polyps, which is a good news. As long as you did not have any abnormal bleeding before you start your Bisane, then I don't think your polyp is about to become cancer. And then now that you're on Bisane, your polyp should be in well control. So don't worry. Afida Kasim asks, what kind of contraception can be used if we have polyp, adenomyosis and fibroid? Nothing. Women contraception? Nothing. If you have polyp, you want to use IUD, Mirena, you need to take out your polyp, but IUD and Mirena also can have problem with adenomyosis and fibroids. You know, if you have all three, cannot. If you have polyp, you can still be on any form of contraception except Mirena and IUD. If you have adenomyosis, then it's best to choose a progesterone form of contraception so that it can control your adenomyosis, like progesterone pill, Mirena, Implanon, Depo, which is a 3-monthly injection. Fibroid, then you cannot use any hormone. And then fibroid also cannot put IUD, tend to cause a lot of bleeding. So also cannot. Maybe if you have all three, the best option is still to treat some of it first. You have to treat something to be able to use something. Like fibroid, you cannot use any contraception at all, other than tying your tubes. Or you remove your fibroid, then we can use contraception. No? Susan Go asked, you mentioned that fibroid and endo is good friends, but what is the percentage of getting endo if you have 2 fibroids, average 2.5? So why I say good friend is because of fibroid, it can actually distort the shape of your uterus and the passage for your period blood to go out. So when your passage of the period blood to go out is distorted, that is why you have more backflow of period blood. That is why you get endometriosis. So actually, we know that about 1/3 of people with fibroid will have endometriosis. So about 1/3 will have. So at the end of the day, when you have fibroids, you need to watch out for any symptom of pain. Fibroid with any pain, you have to think about endometriosis. Let's say you have fibroid for many years and no pain, no period pain, no any pain, no ovulation pain, no whatever pain also, then you are okay. But once you have any form of pain, then you need to think about endometriosis, okay? Like today I saw one lady with fibroid, and she told me that she has this pulling pain on the right side of her tummy 2-3 times already the last month. It's not during period, but out of nowhere you start having this pain with a fibroid, I would seriously think about endometriosis, okay? Okay, Afida asked, let's say we have polyp and we got pregnant, what is the effect of polyp during pregnancy? Bleeding again, no? When you have polyp during pregnancy, you have a chance of having the higher tendency of having bleeding throughout the 9-month pregnancy. It can bleed anytime. It can bleed beginning of pregnancy, middle of pregnancy, end of pregnancy. Of course, it doesn't affect the pregnancy. Actually, it just causes bleeding. But some people, when they bleed, they're so damn stressed, man. I have seen a few women, not many, probably a handful only. They have polyps. They came and see me. The polyp never bleeds. So I say the polyp don't give you problem, don't do anything lah. Then they got pregnant. Then when they're pregnant, they start bleeding. The bleeding is due to the polyp. But because when you start bleeding in pregnancy, you're so stressed. And because you're so stressed, they lost the baby, lor. Because as I say, stress can cause miscarriage. So if you're going to be stressed over your polyp, then might as well just remove the polyp. So after they have the miscarriage, they will say, Doctor, is my polyp causing me the miscarriage? I in a way will say yes lah, because indirectly, it's not directly, indirectly. Earlier I told her no need to remove, but she's so stressed until she miscarried. Aiya, better remove lah. Remove give her a sense of relief, and after all, as I say, polyp removal is only a 5-minute surgery, no pain, no suffering, no side effect. Next day can go back to work. No harm just doing it lah. Okay, Chai Len Lee asks, she got endometriosis removed and got pregnant. Now she's already 9 months after delivery. Period is back. What should I do to prevent endo from coming back? I like to say to lead a stressful life, a stress-free life. That would be one thing you could do. Or put in the Mirena. Okay, considering CMCO, I don't think CMCO is a reason for not seeing doctor. Oh, please don't ever say that. It makes me very angry sometimes because I have so many patients, you know, delayed chemo, cancer never come, all because of MCO and CMCO. No, clinics are open, hospitals are open. We welcome you. Please see doctor. So when your period come back, you should either consider get pregnant immediately get pregnant now, or okay, so if you're CMCO, everybody getting pregnant, right? MCO have so many unexpected pregnancies, so go and get pregnant now. If not, see a doctor. Think about things like Mirena. Mirena is probably the best choice. Azra Leah asks, yeah, she says she agreed with me with the stress level, which is kind of true. Working in a stressful environment every month, she get bad period pain. MC 2-3 days. Now I'm stress-free, working in a very peaceful environment. Period pain still there, but much more better. Still can come to work with no MC every month, happy with me. True, endometriosis is also linked with stress. So why want to lead stressful life? Again and again, I see women come back to me. I tell it's your stress that's causing you problem. Then they tell me, how no stress? Everyone got stress, what? Bullshit. Where everybody got stress? I don't feel stressed most of my days. I can say almost every day of my life I don't feel stressful nowadays. If you ask me 10 years back, I feel stressful. I feel very stressful working 10 years back. Don't say 10 years, maybe 5 years back or so, I'm very stressful. But nowadays, I don't stress at all. What did I do to change? Did I change my job? No. 10 years back, I'm also a gynae. 5 years back, also I'm a gynae. Today, I'm also a gynae. And do I have other changes? No. No. And am I freer now? No. I'm so busy. 10 years back. I'm also so busy today. But I'm no longer stressed. Why? Because I realized the magic of seeing a therapist. See a therapist. See a psychologist. See a counselor. These people, they are good at stress management. When you see them, you let go a lot of things and you'll be stress-free. And when you are stress-free, life is happier and you'll be healthier. Your period pain will all be gone, your endometriosis will be gone. Okay, Suraman asks, she has adeno 2 months ago. I rasa sakit after period, then go to check up. The ultrasound show I have fibroid di luar dinding rahim and my tube also bengkak. Then the doctor advised me to remove. Okay, when you have period pain and you have fibroid, that's a funny story already. So question is it really fibroid? Or maybe it's adeno and then affect your tube to bengkak? That can also be due to endometriosis and adenomyosis. So you are most likely having fibroid with endometriosis or adenomyosis and endometriosis or fibroid with pelvic infection. So whether need to do surgery or not depends a lot of things, Surah. I cannot really answer you this question. It is not a must, but we still need to solve your pain. So that's the most important thing. We need to solve your pain. We need to control the disease. That is the very minimum. Okay? Surgery is definitely one of the options, but it may not be the only option. I need to see you in more detail to be able to answer that question. Fatin Nadira thanked me. She thanked me for saying that period pain is not normal. Women are so used to hearing that we need to just bear the pain and accept it. You're very welcome, Fatin. I tell that every time I talk about endometriosis. Okay, there's no such thing as period pain. Okay, so Kim Hee asked, she took Vicin 6 months last year, stopped since last December, just did an ultrasound and found the cyst grow bigger. Will there be a problem or concern if I take back Vicin? Okay, your mistake was stopping. So you should listen to my endometriosis video. There is no stopping treatment in endometriosis. So you need to go back on some form of medication. If your cysts have grown bigger, then of course you have to go back on Vicin lah. If you didn't stop Vicin, maybe now you can go on milder medication. Okay, so don't stop your medication anymore. Okay, so because sometimes I don't know lah, I see a lot of endometriosis lah, so probably I deal with endometriosis differently. And I also have endometriosis 20 years ago, so maybe that's why I look at endometriosis differently. I have endometriosis 20 years ago, never came back. Why? I never stopped my medication. 20 years already, I never stopped. So you don't take 6 months and stop, okay? I don't let my endometriosis come back. I don't want my period pain anymore. I don't want all the pain I went through anymore. I don't know why people still want their pain. Don't want your pain. Go away forever. Susan Go asked, period pain in day 1 once every 6 months in the age of 30, is it normal? No, of course it's not normal. Some more 6 months only once. That 1 month something must be happening. No, not normal. Most likely you are more stressed that month, so you get period pain. And your endometriosis may have been not so active, but you trigger it on the month that you have your period pain. Sarah said, Doc, how many years does someone may realize it's too late? Like 5 to 10 years, then realize all these symptoms? How bad is it? Honestly, I don't know. You cannot tell one because everyone is different. Okay, everyone is different, so I cannot answer that. All right. Sarah asked, I experienced abnormal bleeding, like you mentioned, like the little one, but there's also one occasion I bleed heavy for 2 weeks, which limit my movements. This result very tired, loss of blood and my stomach ache. Yes. So when you have that, you need to think about whether you have a fibroid or. Hannah asks, when should one consider lab surgery if they've been diagnosed with adeno or endo or fibroid? Honestly, there is no straightforward yes or no. So it depends on you as general. Okay, we have to look at you as general. Hastina, endometriosis, adeno is very stress related. Thank you for seeing my therapist. They work with a lot of endometriosis women. That's why I really encourage endometriosis women to see my therapist. Because there's a difference between my therapist and other therapists. There's only one difference. My therapists work for me. So they only see women's problem with gynae problem. They only see women with gynae problem. There are a lot of very good therapists I know out there as well. A lot of good psychologists out there as well, I agree. But they may not be so specialized in seeing women with gynae problem. So the only difference with that is, because you must understand, if I see women with miscarriage every day coming to me, of course I know how to counsel them better than if I only see them once a month. Okay, so that is one thing. Or I see endometriosis women coming to me every day, then I know how to counsel them better than if I only see endometriosis people coming to me once in a year or something like that. Because a lot of therapists out there, they deal with a lot of real life problem, not really physical problem, but more psychological, mental problem. So they are not really targeting your gynae problem, they are not targeting your endometriosis, they are not targeting your fibroids. So there is slight difference, slight lah. I wouldn't say they can't do it, they may be able to help you too, but my therapists are very specialized. Shall we ask whether is it good to take Bisane to control adeno and endo? Yes, definitely is. Fatin asks, how about cramps leading to ovulation a week before ovulation? All this also you need to think about endometriosis. Okay, do we need to control our diet? I think everybody that is not taking any hormones in your diet, you don't need to worry. So if you eat normal food, then you don't need to worry, okay? Of course, generally speaking, we always say healthy diet, healthy lifestyle, everybody becomes healthier. So lifestyle healthy does not only include diet, it includes your weight as well as your stress management and your sleep. So I like to concentrate on, because everybody talks about food and exercise when it comes to healthy lifestyle. Everybody forgot about good quality sleep and stressful life. That's why I always like to talk about good quality sleep and stressful life. Everybody knows what is healthy diet. Of course, as long as you are eating like normal then you don't have to worry. There's no actual special diet that affects endometriosis unless you're eating so unhealthily. Susan Go asks, how fast does endometriosis spread? As fast as your stress, okay? Stressful people spreads faster, less stressful people don't spread so fast, okay? Alright, so I have answered all your questions and my hospital called just in time. Yeah, I didn't answer. I had to answer after this. So, okay, so that's all for my talk today. So stay tuned again next Sunday. I will post up my next topic very soon, okay? So thank you for following my video again. Thank you and bye-bye.